If you have ever been told that your herniated disc will never heal and that surgery is your only option, that single piece of misinformation may be the very reason you are still in pain today. Because the truth, backed by real research, is that up to 97% of disc herniations can heal completely without surgery, without injections, and without spending thousands of dollars on procedures that never address the root cause. The problem is not your disc. The problem is that most people are treating it the wrong way, and that approach is actually slowing down or completely preventing recovery. A herniated disc occurs when the soft, gel-like inner material of a spinal disc begins pushing against or breaking through its tough outer layer. This can cause the disc to press against nearby nerves, which is what triggers that sharp shooting pain down the leg that so many people know as sciatica. It sounds frightening, and many doctors make it sound permanent, but it is not. A large-scale study involving 280,000 patients with lumbar disc herniations found that 97% of them recovered fully without any surgical intervention. The disc is living tissue. It has the capacity to heal, reabsorb, and return to its normal position, but only when the right conditions are created for that to happen. So what actually causes a disc herniation in the first place? It is rarely one single event. More often, it is a combination of prolonged sitting, repetitive bending, poor movement habits, chronic stress, poor sleep, and an overall lack of recovery. All of these factors reduce the disc's ability to handle load and movement, making it vulnerable over time. And here is the key insight. Because movement plays a central role in causing disc herniations, movement also plays the central role in healing them. This is exactly why people who respond to disc pain by completely resting, avoiding all movement, or relying on passive treatments like massage, acupuncture, or laser therapy, often find themselves stuck in the same cycle of pain months or even years later. These therapies are not teaching the body how to move correctly, and movement is the medicine the disc actually needs. The first step in the healing process is calming the disc and the nervous system down. When someone is living with disc pain, their nervous system is often in a heightened, hypersensitive state. Muscles are tight, the body is guarded, and even small movements feel threatening. A simple but powerful technique to address this is diaphragmatic breathing in a 90-90 position. Lying on the back with both feet resting on a chair or couch so the hips and knees form 90-degree angles, the focus is placed entirely on breathing deeply into the belly rather than the chest. This style of breathing activates the diaphragm, which directly switches off the overactive muscles of the lower back, reduces compression around the spine, and signals to the nervous system that it is safe to relax. For someone in chronic pain, this alone can produce a noticeable reduction in discomfort within just a few minutes of consistent practice. The second step is to actively reverse the pressure on the disc through extension-based movement. The most common trigger for disc pain is forward flexion, sitting for long periods, bending over to put on shoes, picking something up from the floor. These movements push the disc material backward, toward the nerves, which is exactly the direction we do not want. So the logical and research-supported solution is to introduce the opposite movement, extension, which encourages the disc material to shift forward and away from those sensitive nerve structures. This begins simply by lying face down and propping up on the elbows, gently encouraging the lower back into an extended position while keeping the glutes and lower back muscles completely relaxed. As comfort improves, this can be progressed by pushing up onto the hands and extending further. The key is repetition rather than holding the position. Discs respond best to repeated, gentle movement rather than prolonged static holds. Many people experience an almost immediate reduction in nerve pain and leg symptoms after performing this correctly, because the disc is physically being encouraged away from the nerve it was pressing against. The third and final step is building the stability needed to make sure this progress actually lasts. This is where most people fall short. They find something that brings temporary relief but never build the strength and control needed to protect the disc long term. A highly effective exercise for this is a modified side plank with a clamshell motion performed on the knees. From a side-lying position, the hips are lifted forward while the knees separate, then slowly lowered back down in a controlled movement. This simultaneously strengthens the gluteal muscles, the hip stabilizers, and the quadratus lumborum archii, the deep muscle running along the side of the lumbar spine. Together, these muscles form the foundation of a resilient, protected lower back. Without training them, the disc remains vulnerable to re-injury, no matter how much short-term relief has been achieved. When these 3 steps are performed in the correct order, calming the nervous system, reversing disc pressure, and then building lasting stability, many people notice significant improvement very quickly. This is not a coincidence. It is the result of finally addressing the disc's actual needs in the right sequence. The body has a remarkable ability to heal itself when given the right environment and the right inputs. A herniated disc is not a life sentence. It is a signal that something in your movement, your recovery, or your lifestyle needs to change. And when you make those changes deliberately and consistently, the research is clear that the overwhelming majority of people can and do recover fully, return to the activities they love, and go on to live completely pain-free lives.